Hello everyone, I'm Dr. Kavipriya Soma from Athena Women's Clinic. Welcome back to our YouTube channel. Today we'll discuss an important topic that's affecting millions of people around the world, especially women. It's called osteoporosis. I'm sure you all would have heard about it, but let's dive deeper into what osteoporosis is and what it means and how do we manage that. So first of all, let's learn what is osteoporosis. So this word is particularly derived from the Latin word osteo, meaning bone, porosis meaning lots of little holes. So you need to know that there's lots of words in medicine that is linked to Greek and Latin. The bones become thin because of those little holes. When the bones become thin, then it can lead to easy fractures or breakage of bones. Let's do a small comparison of the bone to a honeycomb. So just like how honeycomb has got small holes within it, similarly, our bone structure also is very similar to the honeycomb. Even though it has got small holes, it does provide the strength to hold our weight. Now, in osteoporosis, what happens is the bone thinning can enlarge these holes. So the overall thickness of the bone structure goes down and it's easily breakable. So if you understand the concept, then you'll understand what osteoporosis means. So far, we have deciphered what osteoporosis is. Now we will go into the depth of why it happens to some people more than ever as compared to other people. Now, there are risk factors for osteoporosis, and sometimes there are risk factors for both men and women. But in women, the osteoporosis sort of worsens after menopausal or during menopausal age group, mainly because estrogen, the hormone, acts as a natural protector up until that point in time. When a woman hits perimenopause, menopause, because of the hormonal changes, the estrogen content goes down, which indirectly affects the bone strength, leading to osteoporosis. Now, before it goes to osteoporosis, there is a stage called osteopenia, where there does occur thinning of the bone, but not to the degree of fracture. So there's always methods and treatments to prevent it going from penia to porosis. We have just mentioned what are the risk factors, but let's delve a little bit deeper into that. So as mentioned, in women, postmenopausal osteoporosis, the risk is higher because of the estrogen hormone changes. But also there are other risk factors as simple as lifestyle factors, not exercising, smoking, alcohol consumption. So that can affect both men and women. There are a couple more factors that are quite important as well, is your family history. So if there's a family history of osteoporosis, you have to take extra precautions right from the beginning, or it could be just your body type. For people who are of smaller frame or a petite frame, they already have lesser bone mass, and then osteoporosis affects that bone mass which is available, and the degradation is quicker and faster, leading to an increased risk of fractures. So natural progression would be to the next question: what are the symptoms of osteoporosis? Unfortunately, osteoporosis is a silent disease until a fracture happens. So you may not know it until that point in time. That's why prevention is better than cure. As mentioned earlier, we did say that prevention is better than cure. But how do you know if you are struggling with osteopenia or osteoporosis? There is a test called bone mineral density test that is very similar to an X-ray CT. What it does is it measures the density of the bone in your spine as well as your hip joint, and it compares to a large population, normal population, which gives us the scoring, and then that would decide if you are actually in the range of osteopenia, that is just bone thinning, or osteoporosis, where it's really thin and ready to break. So that is how we diagnose or pick up osteopenia or osteoporosis. So we just discussed about bone mineral density screening, or DEXA scan. Now, that will give us a diagnosis of osteopenia or osteoporosis. Of course, if you are diagnosed with either of this, then definitely seek help from your own healthcare professional, or visit us at athenawomensclinic.com.au to discuss your condition further. But how do we prevent this? That's very, very important. The prevention involves important lifestyle factors. First things, good nutrition, or nutrition containing high calcium. If you're not getting a high calcium from your diet, then you need to take supplements of calcium. But generally, calcium can be obtained from various dairy products like milk, cheese, yogurt, or cottage cheese, and all varieties of that. But if you are vegan and you don't eat dairy products or cannot tolerate dairy products, then you could also look at spinach and kale, or you can look at options like tofu and almonds if you're not allergic to them. So these are your important food groups that you can have, which are rich in calcium. Now, calcium alone is not enough. You have to take vitamin D along with calcium. Now, how much of vitamin D to be taken will be determined by your blood test. Now, that can be taken in the form of capsules or liquid. So definitely seek help from your healthcare professional regarding how to measure your vitamin D and take appropriate supplements. But nature is free and in abundance. What you can do is expose yourself to sun early in the morning or later in the evening when the UV rays are at its minimum for just about 15 minutes a day without sunscreen, which will also help the production of vitamin D from the skin. So we talked about diet. Let's talk about exercise. I'm sure all of you are doing that, but to enhance or prevent osteoporosis, weight-bearing exercise are very, very important. So along with your cardio, you have to do weight-bearing. That doesn't mean just simple jumping. It has to be with full force of jumping, wherein the calcium can then go and deposit itself in the bones. And I'm sure if you search social media or Google what the weight-bearing exercise mean and what you can do, the social media and Google is riddled with it. So go find what suits you and start doing that straight away. So we've spoken about what to do. Let's see what not to do. Two important things. I'm sure if you've been watching our videos, I always say no smoking, no alcohol. Well, occasionally you can have, but again, long-term regular consumption of alcohol or tobacco or smoking is not helpful in any ways. So far, we have discussed about the non-medical management of osteoporosis and prevention, but let's see what are the medical options that we have. Now, to discuss this option, this would be definitely advised by your own healthcare professional. So please speak to them before you embark on this journey, because this depends on associated medical conditions and what you can tolerate as well. One of the important things that is available is just tablets. It can be tablets or it can be injectables. And that decision will be based upon what you can tolerate and how frequently you need it. So like mentioned, please go see your healthcare professional in terms of medical management. In postmenopausal women, sometimes we may just use menopausal hormone treatment to help osteoporosis as well. So just be aware there are multiple medical options available. Definitely you need to seek medical help for that. So if you are diagnosed with osteoporosis, the important and prime thing is to prevent fractures. And how would you do that? Definitely make sure, go around the house, make sure there's nothing that you can trip over and fall. So just some slight modifications to keep you safe is really important. So good shoes, avoiding the little hazards at home or at your workplace, making sure that you continue with your lifestyle modifications, exercises, balance training is really important. They will all help you manage your osteoporosis better. If you're not sure if you're at risk for it, definitely seek medical help or health professionals' help who can do an assessment, take your family history, calculate your BMI, and then see or assess your risk for osteopenia or osteoporosis and perform necessary bloods or investigations like the DEXA or the BMD scan and assess for osteopenia or osteoporosis. Thank you for watching our YouTube channel. I have tried to simplify the topic for you, but if you do have further questions or if you'd like an opinion, then please visit us at athenawomensclinic.com.au to make an appointment or discuss the concern with your own healthcare professional.